I know one of the really challenging and sort of shocking things about what happens after a seizure is being told that you can't drive. That's a really hard thing to figure out with your family. You may be needing more medical appointments, et cetera, et cetera. So this is from the California DMV website. And what they define as seizure is one of these lapse of consciousness episodes. So the definition here is regardless of what causes a lapse of consciousness disorder, it can affect one's ability to operate a vehicle or vessel. If you lose consciousness for a short period of time, you can also lose control of your vehicle, which can result in serious accidents or death, not only, of course, for yourself, but potentially for someone else. And so these laws about driving, it's really important to understand, are state specific. I've lived in 4 states, and California is the only state I've lived in where it is my duty and legal responsibility to report a lapse of consciousness episode. So even if passed out or not quite sure it was a seizure because it might have been unwitnessed, these are still lapse of consciousness episodes. If you have an impairment in your consciousness, until we get those under control, it's not safe to drive. And so what we have to do as physicians is report these episodes to the Department of Public Health. And then the Department of Public Health in turn will contact the DMV, and the DMV will send you, as the patient, additional information. I think it is also important to understand that when and how you get your driver's license back, which most likely you will, is really up to the DMV. And so we as the physicians provide testimony to what we think that risk is, but these are the things that I took off of the website that they include that the DMV uses to factor in gaining your driver's license back. So effect of the disorder on the physical and mental abilities which are necessary to safely operate a vehicle, individual's testimony regarding his disorder and ability to drive, testimony of other individuals of the same, whether or not the seizure is under control with or without medication, individual's compliance with the prescribed medical regimen, other medical conditions, the individual's driving record. So that's not something as your doctor that I'm going to have any information about. So again, that's part of the factor that the DMV considers. Other relevant factors which may affect the individual's ability to drive, and a current medical evaluation conducted by a physician. And so I think it's important to understand you can be on anti-seizure medicine and still get your driver's license back. So this is an example of what the DMV sends you. It's 5 pages, and the first page is mainly information about you. It's a PDF that's readily available. You just Google it, but this is from the DMV from California. On the right is the part of this 5-page document that your neurologist or your doctor will need to fill out, and it attests to this lapse of consciousness disorder, which we have previously defined. And so it says, when did this last happen? How often is this happening? For how long have these been happening? Are you compliant with your medications? Are there drug levels that need to be followed? So all of these are parts of this form that your doctor will fill out and then send directly to the DMV. And usually what happens when something like this occurs, when a lapse of consciousness episode occurs, that someone's put on medical probation. And there's a couple of different types of medical probation, but the one I'm most familiar with for sure is type 2, which is for drivers who have achieved 3 to 5 months of control. The driver is required to authorize their treating physician to complete the driver medical evaluation. That's the 2 pictures that we have just looked at, and submit it to the DMV on a prescribed basis. I usually do this once, and then the coordination is between you and the DMV about how to get your driver's license back. And again, the decision to place a driver on medical probation should be based on combination of considerations: seizure type, manifestations, medical and lifestyle history, and the seizure-free period, which is, I think, the most important component of things. For medical probation type 2, patients can resume driving after at least 3 months of control. Again, this can be discussed with your doctor. Sometimes it's up to 6 months. There is also a medical probation type 3 for patients who need at least 6 months of control and are at risk for another seizure for whatever particular reason and require regular reporting to the DMV. And unfortunately, my understanding is that patients who have had a seizure or have a history of epilepsy aren't able to hold a commercial driver's license, so to be a licensed truck driver and drive across state lines. And so I think that that can be a very frustrating thing as it relates to work. So again, 3 months to 6 months, depending on the discussion with your doctor. But the vast majority of people are able to get their driver's license back, even if they're on anti-seizure medication.